It is time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic and a special guest as well today. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, Wednesday morning crew.
Yeah, we've got a crew. The places I go to here and there, folks are listening for Wellness Wednesday, and today you're going to talk a bit more about hyperbarics.
Yeah, absolutely, Dave. You know, this, again, we talked last week about it. Feel like we need to occasionally reintroduce some of the amazing offerings that we have here in the space at Okoboji Wellness Clinic. And one of the first things we started off with 4 to 5 years ago was hyperbaric therapy. And the more that we work with it, the more that we are amazed, the more foundational we believe it to be for helping the body find balance and get into that healing space. And we continue to perfect it, go in and get additional training, learning the particular protocols that are best for individuals to help them on their journey to feeling better every day. And I thought it would be wonderful to bring Paisley, who has been with us quite some time, and she's been all over the clinic playing many roles. She's a CNA, and she is the head of the hyperbaric area in our clinic. And just to briefly recap, before she shares some of her experiences and what it might look like to come into the clinic here and start the hyperbaric journey, is what exactly, again, is a hyperbaric chamber. What's that all about? And it's a function of pressure, oxygen under pressure, and a whole bunch of metabolic processes that are triggered, or in many ways, I call it the ruah. There's well over 15 different mechanisms of action of how this incredible therapy works. It is an experience in a chamber, a soft chamber, who we have here, that folks will go on as part of their journey to feel better. And so many times folks will come in with a hyperbaric consultation with me on the front end. We will talk about their history, what is leading them to feel like I'm not having the fullness in life that I want to have. And hyperbarics being so gentle, being so safe, it is an incredible place to start the journey, that wellness journey. Paisley can share with you what it's like to walk through that experience, coming in for a treatment, maybe some on what she's experienced, what she's witnessed over the last 3 years with our guests that come in here. It's a privilege to get to watch and walk with people on the journey, especially the ones that have been frustrated and feeling like there's no hope and they've not made the progress in their health and wellness that they'd hoped for. Without further ado, here's Miss Paisley.
Good morning, Paisley.
Good morning.
So walk us through what it's like when somebody comes in, they've got a hyperbaric appointment. Take us through that. Walk us through that, if you will.
Yeah, we have patients come in from all over. So some patients that are coming from a distance, we try to get them to do a double session. So they may be in there for an hour to 2 hours, just depends how hard we're going to hit that. So when they get here, we do offer a pillow and a blanket for you to get nice and cozy in the chamber. You're able to read in there, and just a time to unwind. I've noticed all of us are guilty of being so connected to our phones and devices, and this is just a time to be unplugged and to just really focus on that healing. I've personally taken some pretty incredible naps inside of the chamber. We have patients do that, but yeah, just that importance to sit back and just be in the now and to get focused on healing the body.
So, Paisley, if you would, highlight maybe one or two of the success stories you've seen working with people in their hyperbaric journey?
Yeah. In the last 3 years, I've seen and walked with people through some incredible healing. And one story in specific, we have a lady that comes from South Dakota. She's just been dealing with a lot of chronic pain, fatigue. Her list is quite long, and this has been a struggle for her for 10 years. She ended up having to quit her job that she loved, just couldn't manage her pain anymore. She just really couldn't get out of bed. So she started coming, and she comes from a distance, so she's doing the double sessions and just trying to hit it hard. And just the change I've seen, not only in her healing, but her personality. Dr. Meyer and I got to sit down with her and her husband last week, and she just talked about how she was skeptical of coming, and her husband was pushing her more towards it, and she just was kind of no hope that thing was going to work or that her life was going to change. She said that the doctors prepared her to be in a wheelchair in a couple years, and she didn't want that for herself. Her pain, her chronic pain and inflammation has decreased tremendously. Her personality has changed. She's not so tired all the time. She shared with us that she was able to deep clean her kitchen, which might seem small to others, but that was a huge win for her to be able to complete that task and not feel crummy after completing that.
That's awesome. That's a great story. And sometimes we've heard the stories, Dr. Myers shared some, and now you're sharing another here, where sometimes people come to see you, they're like at the end of their rope. They've seemingly tried about everything, and they don't want to feel this way anymore, and their pain is almost intolerable. And for whatever reason, hyperbaric being in that chamber, and it varies, I know, for people on how many sessions or dives they have, but they start to see the success, and it's pretty incredible.
Yeah. Another story I had was a mom who had a little boy. We treat of all ages here and all different angles, and a mom and her little boy, he had a chronic cough that they just couldn't get rid of, and she came in one day, and I could just see the defeat on her face. And I'm a mom, so my mama heart was sad for her, and that's what we're here for. We just want to help. We just want to see people thrive. And we had the little boy do some hyperbaric sessions with his mom. He went in the chamber with his mom, and she had reached out after 5 to 6 sessions, and she was so grateful. His cough had improved. He wasn't lethargic. His energy was back, and that was just a reason. That was my why. That's why we do the things that we do. That's why I love coming to work. I love to hear and see and walk people from day one to in the middle and in the end of their journey of healing.
That's awesome. Dr. Meyer, you've had some amazing success stories at Okoboji Wellness Clinic. And by the way, if you don't know what a hyperbaric chamber looks like, I would invite you to head over to Okoboji Wellness Clinic and just take a tour. But you can also go to their webpage, okobojiwellnessclinic.com website. But on the first page down a little bit, and you'll see all the chambers there, or most of the chambers that they have at Okoboji Wellness Clinic. And they just look like glorified ice houses, fishing ice houses, and they're pretty incredible. But Dr. Meyer, we happened to be talking yesterday about the Cedar Cabin, which reminded us of the son of Al Mataloni, who owned the Cedar Cabin in Ashton, and he came to you, and we think these things are just never going to go away, but he hadn't been able to form any saliva or spit. And his greatest accomplishment in the hyperbarics was being able to tell somebody, hey, you know what? I got some saliva here. This is amazing.
Dry mouth after treatments with radiation years back and having to live that way, expecting that was going to be the way it was going to be. And a lot of times when we see folks, and a lot of what we do is, again, quote-unquote off-label. There's 15 conditions with hyperbarics that are treated by insurance with the high-pressure chambers that you might see in the hospital. Initially, there was only 3 or 4. And before those other ones became on-label treatments that were approved for insurance, they were off-label. And what that means is, really, there are hundreds of conditions, chronic conditions, whatever that label that is been given maybe by the doctor for a disease, a diagnosis. These conditions are supported in a very positive way through hyperbaric therapy. Now, you can't go into a high-pressure chamber for these types of situations. They're not approved for insurance. Again, it's an off-label approach to help the body find balance, help the body in a healing pathway. So and there are, like I said, well over 15 different mechanisms of actions, from angiogenesis, which is making additional blood vessels, to increasing stem cell support signaling, decreasing cytokine production, which is inflammation, lighting up, and well over 5,000 genes, up and down regulating different genes that are needed to help optimize the body's function. I could go on and on. It's mitochondrial function, which is making energy, or ATP. In Dick Mataloni's case, and in many cases, when I look into, we call it the penumbra, and this is for folks that have had a stroke. There's a portion, and this isn't this individual in particular, but when we talk about injured nerves, so it's similar, from radiation that he had done and then had the hyperbarics and the spit restored. But let's say somebody that had a stroke and a portion of their brain lacked oxygen for an extended period of time. Now, there is a portion right around the penumbra, and where it is the penumbra, that is outside of the area of the central hypoxia, so the area that had the least amount of oxygen. There's an area around it. Think of a dartboard, and in the center of the dartboard is the area that had the least amount of oxygen with a stroke. The area around that's the bullseye. The dartboard is the area around it, and that's the area that tends to be, when we start to feed it pressure and oxygen, that nerve tissue can start to activate again. And this is where you can see recoveries from many different indications, many different situations, in particular brain and nerve-related, central-related. And again, what we were expecting for Mr. Mataloni coming in prior to doing to stimulate stem cells and health healing before he had oral surgery, per his dentist, go get some hyperbaric therapy. Which is a great reminder of everybody should highly be considering hyperbaric therapy before and after surgeries to help the recovery time, reduce risk with surgery and such. But he came in with that idea. I was like, all right, I'm here because my dentist said hyperbarics are going to be good. It's going to help around the time of surgery. And then the bonus, he had several bonuses. One of the big ones, that the saliva returned, and he also noticed that the hip pain got better. And so when we come in, that's why I like the hyperbaric so much. It touches on so many different areas that somebody might come in for one particular thing and have a laundry list of 10 different things. And as they continue to go through the treatments, or the hyperbaric dives, is the appropriate term, they start to notice that the different parts of their body are responding to the pressure and the oxygen. It's really, we encourage folks to document and journal their experience, because so much is happening that by the time of it, they almost forget, oh, yeah, I used to live with that every day, and now it's gone, and they're working on that next layer of the onion, so to speak, with the pressure and the oxygen. It is a commitment. It's a commitment to healing and supporting that body's ability to heal, and it's something that's not something somebody should consider as a one and done. It's like putting in reps at the gym. We like to hit a plateau until we get maximum improvement, and once we get there, some people may not need any more, and some people may need clusters over their lifetime to continue to recharge, what I like to say, recharge that battery. But when folks are feeling better, when they've tried so many things, it's certainly something that's quite easy to do, because You come in, there's no IVs, no pokes. You get the amazing care of Paisley and the rest of our team, and an amazing rest and relaxation. The other thing is we really like to measure change for folks. We want to confirm, all right, beyond just feeling better, what can we do to measure that change? So we use a treatment and tool called the brain gauge, and folks start off with it's a vibration sensory test that is only 90 seconds. They sit at a table before, after hyperbarics, and it's able to measure the changes. So what we see is folks' reaction time, their cognitive abilities change in a very positive way, their ability to multitask. We're able to measure it with this brain gauge vibration device on a tablet. And that's another nice way for folks that maybe after 5 or 10 treatments, they aren't yet noticing a big shift yet, but their scores on this brain gauge as a measure of progress and process are showing improvement. So that's also, we want results, we want to be able to confirm that progress. And this is why we work with Dr. Mark Tabernall, who is with UNC, a professor there for many years, a neuroscientist that developed this brain gauge with DoD funding. And he's always monitoring. We're a beta testing site, a center for excellence for the brain gauge here. And we're getting active monitoring from North Carolina with every case that folks will walk into the hyperbaric chamber. So he's able to create case studies and confirm the efficacy of hyperbaric therapy by watching people's scores improve on the brain measure.
That's awesome. Dr. Meyer, we're out of time. We got to run. So if people want to get an appointment with you or come see Paisley, come look at the hyperbaric chambers, what's the best way?
Yeah, give us a call at 712-339-6024. And we are at 3305 Berquist Avenue in Spirit Lake off of Highway 71. We do discovery calls. That's Mychal Sheridan for reflexive brain work and orthopedic massage, Molly Avery with functional nutrition. She also is another entry point to taking the journey from front to finish. Phenomenal. She's been at it for 20-plus years, and she's really amazing. So we all offer these discovery calls, complimentary if you're wanting to start the journey. And again, some folks want to just start with hyperbarics, and in that case, it's an easy entry point because we make a hyperbaric consultation with me, and I will get into the great details of hyperbaric, create a hyperbaric protocol with the individual, and lay out what the next 1 to 3 months might look like with a hyperbaric therapy. So 712-339-6024. You owe it to yourself, you owe it to your kids and your family to be your best, feel your best, and to thrive, not just to survive. That quality matters. We want happiness and joy. We want wellness for everyone. We got an amazing team here that is empowered, got incredible empathetic hearts, and love the mission here to bring people forward and down that healing journey.
Very good. Dr. Meyer, thank you so much, as always, for your time. Paisley, thanks for being with us this morning. We'll chat again very soon.
Thanks. Everybody have a great day. Be well.
Thank you, Dr. Meyer. Dr. Bradley Meyer at Okoboji Wellness Clinic. Again, you can go to their website, okobojiwellnessclinic.com.